Hi everyone. I just wanted to talk a little bit more about a few of these structures. So before you have a humerus, and on the head of the humerus you have this articular cartilage, and this articular cartilage is just going to be there to provide this smooth, lubricated surface that helps bones move, right? And so you won't see this in all bones, but you'll see this in all long bones anyway, right? So the shaft of a bone is called the diaphysis, and in the internal portion of a bone is called the medullary cavity, right? And if you look here, so I don't know if you can see here, this is the outside of the bone, but if you can just sort of look on the inside, this is the medullary cavity, right? And in a real bone, in a living bone, this medullary cavity will be filled with this yellow stuff called yellow marrow, right? And this yellow marrow is actually fat. And in adults, this is how it is in adults anyway, but in adults, the red marrow is sort of in the epiphysis, right, which is going to be kind of on the top of bone. In fact, that's to be the proximal epiphysis, right? So this is going to be the red marrow, and this red marrow sort of extends maybe a little bit more here, but that's going to be involved in making red blood cells. And where I have my my little pointer, this is going to be spongy bone, right? So this is going to be spongy bone, but on the outside of the bone, and you can actually see where the thickness of this is. This is going to be a hard bone, right? And so sometimes you may have, it may be referred to as compact bone. So compact bone, hard bone. And you can see a little bit on this is the real bone here. You can see the compact bone here. So this is kind of the real bone. See that there. So if we look sort of at the microstructure of bone, so we zoom in, you can kind of see like a big O, like here's an O and here's an O here. And each of these are going to be osteons. And even though each large line is going to be a lacuna, which is going to have a cell in it called an osteocyte. This osteocyte will sit in like sort of, this is like 12, and this is 1, and this is 1, and this is 1, and it sends out these tendrils called caniculi, which then attach to other osteocytes, which then attach to what this structure is called the central canal, right? So I don't know, you may not necessarily need to know the central canal, but all of this brown that you see is called lamellar bone, right? So you can kind of see. And in fact, this is the type of, I forgot the type of bone that's in here. So it's with a C, I cannot remember it. But the bone that is between these osteons is called an interstitial lamellar bone. But you don't need to be able to differentiate that. All you need to know is that all of where I'm putting my pointer at will be lamellar bone, right? So there you go, right? And so if we were to kind of maybe zoom out, on the outer surface of bone, you would actually have this structure called a periosteum, right? So this actually is very vascularized. So though on the dead bone that you see, you don't see that. All you would see would be sort of the compact bone, right? So and then so you have the compact bone, and you can kind of see, you see where these little circles are. Those are all going to be osteons, right? So osteons, right? And then you can see that they're kind of pulling up an osteon, and in the middle of an osteon, that haversian canal or central canal is going to have blood vessels coming out of it and nerves. Okay, so I think that is it.